I just wanted to get your sense as a psychologist. You've got a healthcare worker who is balancing kind of his profession against their personal safety, and I just wanted to get a sense from you is how do you address that balance?
That's a really interesting question because in Kingston I have friends in the healthcare system, nurses, etc., and I know people who are at risk physically, and they're in situations that are uncomfortable. As we heard from the panel, you know, a lot of things that go on in regards to the threat that people perceive and the interpersonal kind of experience with that kind of moral courage that's involved with that. And for some people, the response is just, this is how I would behave, and I'm just going to go. There's not a lot of emotion involved with it. And sometimes those people throw caution to the wind, and that's a decision they come up with. But for the most part, people are pretty conscious now of the risks that they are, you know, to others around them as well as themselves. And that's something that's weighing on people more than the individual risk of the health provider, in my experiences. So people are trying to reconcile that with information. And, you know, that's the big thing right now compared to our first time we were on the webinar. And of course, like you pointed out, week by week, as more information becomes available, I think as we are able to gauge risk and also have experiences in being confident that you're able to produce the behaviors that will help keep you safe, that promotes, you know, proactive behavior into these situations. If you're not confident and you're fearful, those types of things can create not only anxieties and fears, but also distances in regards to those behaviors. So people are going to be less likely to engage in those jobs comfortably or at all if they don't feel they have a sense of control in what they're able to do. And that's probably the key point, control.